Namaste. Today we are going to do some poses for back pain relief. So there will be some strengthening poses which makes you compress your lower back. And there will be some nice gentle twist poses which are safe for any disc diseases. And also some core strengthening along with the back strengthening poses. So we will start. So take a comfortable mat. Make sure it's a yoga mat which is stable and a bit grippy. Keep the hands on the mat and lie down, stomach down. So we will straight away start the crocodile position, Makarasana variation. Adjust yourself, keep your pelvis grounded on your mat and keep your hands under the chin. Now take a few deep breaths. Inhale and exhale. Relax your shoulder and neck. And feel the breath at your lower back. Now we'll start bending one leg at a time. If you're not comfortable with your hand under the chin, you can even keep the hands down like this. Make sure you're not collapsing your shoulders, keeping your shoulder and neck straight, upright and active. And two legs at the same time. Inhale, lift, exhale. Inhale, exhale. Inhale, exhale. Inhale. Now we relax. Hands like pillow. Forehead on your hands. Relax your neck. In our next position, we are going to do the locust exercise. So you will keep your hands on the mat and then engage your back muscle. Stomach, you feel the stretch of the stomach by lifting your chest up. You're also using a bit of your arm strength by pressing the elbow. You just look straight forward. Your neck is neutral. Just look straight down at the floor in front of you. You're going to try to very gently raise your left leg up without tilting your hips. Inhale, exhale. Now you should feel the compression at your opposite side. Inhale, exhale. 3 more. Inhale, exhale. Inhale, exhale. And last one, and stay for 5 counts. Inhale, 1, 2, 3, 4, 5. Relax. Now you will rest for a while so that you will have energy to do the other side. So head down. And now before we do the other side, you can turn your ankle facing the toes to the side, the corner of your mat, and try to press the heels down. Now we will do the opposite side. So again, your hands in front of you. Make sure you're not collapsing your shoulder like this. This will mess up your posture. Make sure you're activating your muscles. Fingers press the mat. Take deep breath. Inhale and exhale. So 5 times. Inhale, raise without tilting them. Exhale, down. Inhale, 2. Exhale. Inhale, 3. Exhale. Inhale, 4. Exhale. Inhale, 5. And stay 1, 2, 3, 4, and 5. Relax. Then hands down, forehead on your hands. So again, look at the feet, turn the feet out, the toes facing out, the heels trying to press it down. Any discomfort, do not force your feet or anchor down. Now we will do one more compression exercise, that Bhujangasana. So you will keep your hands right under the shoulders. You can spread out your fingers so that you can evenly press your fingers down to support your lifting. Keep the legs together. Point your toes. Now you will slowly bring your trunk up and look up. Any neck discomfort, look forward. Inhale. Raise the chest and the ribs. Keep the navel down. Exhale. Inhale. Raise. Exhale. And try to feel that compression. Squeeze the glutes. Inhale. Raise. Exhale. Inhale, 4. Exhale. One more. And you try to stay for about 4 to 5 counts. And slowly down. Now rest your hands beside your body, hands down, arm facing up. Turn the head to any one side. And turn the head to the other side. Now you will slowly recover your back in that child's pose. Lift your hips up, bring the knees to the front, separate your knees, and then slowly sit on your heels. So if you have any neck pain or injuries, avoid hanging the head down like this. Then keep your arms down. Just keep the neck neutral and push yourself backward. Otherwise, you can straighten your arms and then bring the head down. And after 5 breaths, okay, come to the kneeling position. So if you have any knee problem or knee pain, you can avoid this exercise. Otherwise, you can try or keep a knee pad or towel or some cushion under the knees. So the knees are hip width apart. So this is the hips. Hips are here, so it should not go beyond the hip. So keep it in. And the knees are not supposed to be together. Okay. Now we will show you the side view. And keep the hands at your lower back like this. The thumb is touching each other. Spread out the fingers. And then inhale. And exhale, you will pull the belly in and slowly push the pelvis forward and lift your chest. Exhale, slowly come back and sit down. And hunch your back, round your back. So we will do another 4 more times. Hands at the hips or lower back. Inhale. Exhale, belly in. Push the glutes with your hands and lift your middle chest. Lengthen your spine. You should not feel any pressure at your lower back. Look forward. Then slowly release. Sit on your heels. Hands on your knees and round your back. The third one. Lengthen the spine, chest higher. You can push a little bit more. Make sure you're not feeling pressure at your lower back. Inhale and come back to sit. And round your upper back. Two more. You will push as you exhale. Inhale, come back. Sit and round your. Last one. If you are flexible, you can hang the head, look back. Otherwise, just look in front, chest up. Take few deep breaths here. 1, 2, 3. Inhale, come back. And exhale, sit. around you. And now we will do the last few poses. So you will be lying down on your back, some supine twist. So adjust yourself as you lie down. Make sure your neck is not tilted like this. You have to keep the neck straight. So lift up the head, then lengthen the neck. So your chin is pointing towards the chest. Bend the right leg and hug. Lock your fingers, press the knee, slowly, gently. And as you are pressing the knee to your chest, very important, the left leg has to be straight. The left calf muscle has to touch the mat. And feel the lower back on the mat. Try to feel your back on the mat. Press your lower back on the mat. Even your shoulders, your scapula is on the mat. And change other side. Inhale and exhale. So at least 5 deep breaths. And try to squeeze your stomach. Engage abdominal lock. Exhale, release the leg. Now you will spread out the two arms at the level of your shoulders sideways. And then you will raise your right leg up and you try to bring it towards your left hand. And you look at the right side. Inhale, come back. And that same right leg, you're trying to reach the right hand and look left side. Inhale, come back, center. And continue 4 more times. Exhale to your left hand and look right. Inhale up. And exhale to the right side. Trying to reach the right hand. Keep your left hip grounded. Inhale up. You can bend the knees if you have too much pain. Exhale to the left and look right. Inhale up. You can bend the knees here. And extend, straighten the leg. Inhale up. Exhale left side. Inhale up. Exhale right. You can spend some time here, about 5 to 10 breaths if you're feeling comfortable. Inhale up, center. You can bend your knees. And exhale to the left side. You can hold your leg or use a towel or strap if you can't bring that leg to a certain height. Hold the leg and press the right shoulder down and look right side. You are able to see your entire right arm. If you cannot, avoid forcing to turn the head. Inhale back to the center. Now we will repeat the same at the left side. So just check your spacing. Have space both sides. And we'll start. Left leg up. Inhale. Exhale. Twist first to the right very slowly. And look left. Press the left shoulder down. Inhale up. Exhale left side. Open pelvis. You can catch your leg if your leg is very close to your hand. Otherwise, it's okay. You can keep it lower. Ground your both hips. Inhale, center. Exhale, twist and look left. Inhale up. Exhale, open pelvis. So you can use your hand support to adjust your hips. Look right. Inhale, center. Exhale, twist. Inhale, center. Exhale, open. Inhale, center. Exhale, twist. Inhale, center. Exhale. So I'm using my hand to help grounding up, to ground my pelvis and the glute. Just stay here for a while. You can catch your toe, you can catch it, otherwise use a towel. You can wrap a towel around, strap. Let go. You can bend the knees to the center. And now twist and stay there for at least 5 to 8 or 5 to 10 breaths. Look left side, round your shoulder. You can hold on to the toe or use a towel strap or simply just hold the knee. So you can see this entire left arm. If you cannot, it's okay. Avoid forcing the turning of the head. Inhale, bend the knees and come back to center. And relax. Now you will hug your both legs. So bend the two legs, round your back, and rock left and right. You can lift up your head and adjust your back muscles. Now join the knees together and try to hold the side of your both feet. Make sure you're not separating your knees like this. Join it. Now lift up the head, round your back, and try to reach the forehead to your knee. Exhale to reach. Inhale, head down. Exhale, stomach in. Inhale down. Exhale, head to knee. Inhale down. Exhale. Inhale. Exhale. Inhale. Now hold your knees and press the knees to the stomach. Press the lower back down. Now your legs down. Then rest.